This is Dr. Kevin Christie, your Boca Raton chiropractor. Today we're going to go over the difference between carpal tunnel syndrome and Pronator Teres syndrome. It's subtle but a big difference. In my opinion, too many people get sent for carpal tunnel surgery that actually do not have carpal tunnel, and it's it's an unfortunate situation that's happening. It's a misdiagnosis that's causing a lot of ramifications after the fact. And so we want to work on getting rid of that problem in our typing, our people that are gripping a lot in the gym. Even pregnancy can be an issue. Sometimes people that are pregnant can get wrist issue because of swelling, and it kind of mimics carpal tunnel. Pronator Teres syndrome, there's a muscle that runs right into the inside of the elbow. So from here to there, it pronates the wrist, which is this movement here. So that's why typing is a problem. And when you're like that and you're typing or you're gripping or doing anything golf like that, it's going to overuse that muscle there. And so the median nerve, which is the nerve that actually gets entrapped in carpal tunnel, it runs right through that area. And it actually can get kind of tethered to a tight or scar tissue riddled pronator teres muscle. And so we'll go right into that area on a patient, and it'll kind of reproduce their symptoms. Now, what the biggest differentiating symptom pattern between the two is, if you have true carpal tunnel, you're really only going to get symptoms like pain, numbness, and tingling with the thumb and the forefinger and in kind of this thumb pad, right? With Pronator Teres syndrome, you're going to get more of a whole hand, or even the wrist and the whole forearm, okay? So that's a big differentiator, because what happens is the sensory branch of the nerve actually goes over the carpal tunnel, so it doesn't go through it, so it can't be entrapped, right? And so that branch is the real indicator for us on what's going on when we're doing an exam and kind of the history and consultation. And so that's what we want to figure out. And if we diagnose it as Pronator Teres syndrome, that's really good news, a lot easier to get rid of than carpal tunnel. And we do something called active release technique, where we go into that area where the muscle's tight and where the nerve is entrapped. We shorten the muscle in there, and then we lengthen it just like that. And so we really work a lot on all these forearm muscles, and that usually gets rid of the symptoms. We're also going to check the neck and shoulder, so there's some of the things that we need to work on to make sure that's not an issue. And then we'll do certain things like stretching, deep tissue laser, and some workstation or exercise modifications to get rid of it. But we get a lot of people that come in with this condition where they automatically assume they have carpal tunnel syndrome, and as we go through the whole exam and the whole process, we figure out, no, it's more the Pronator Teres syndrome right into there that we're dealing with. So that's something to take into consideration. If you're having wrist forearm pain, we can check that out for you to make sure it's something like that versus the dreaded carpal tunnel. If it is carpal tunnel, we can do the active release and the other treatments as well. It just would be completely different. But ultimately, the biggest mistake that's happening is people have the issue here. They're getting the treatment and sometimes the surgery here, and it's not fixing their issues. So always want to make sure you're getting the diagnosis correctly, because otherwise the treatment's not going to be helpful. Hope that helps. Make sure that you take that into consideration if you're dealing with this type of pain syndrome.